Hello, everyone. Welcome. Great to have you here tonight. For those of you that are on live, if you could do us a favor and in the chat, make sure it says to everyone instead of to host and panelists. So change that to everyone. And then go ahead and share who you are, where you're from. And then if you could let us know if you're already doing functional testing as part of your business or completing FCEs, or if that's something that you want to add on to your business. If you could share, that would be great because that will give us an idea of who we're talking to. Plus it allows you guys to connect as well. So very excited to have Mike and Kevin here today. We met courtesy or around Laura, who's actually one of our attendees here today. Gosh, when was it that we meet? Beginning of the year, I think?
Exactly.
Yes, we met about the beginning of the year, and we met because my practice, well, Laura, who's in our therapy business builder program and has a private practice in Omaha, she came to me like a year or two, I don't even know how long ago it was, Laura, and had this great opportunity to work with attorneys doing functional capacity assessments. And she ended up meeting Kevin and utilizing metrics. And then when we started to get interest from like our workforce safety and so forth, then Laura recommended I reach out to metrics. So I met Kevin and Mike there, and we do them in our clinic as well here in North Dakota. And then we're like, this is a great functional capacity assessments, just functional testing in general is a great addition to therapy practices. It's also a great way for therapists that want to get started in private practice. They can even just kind of focus just on FCEs in some locations, depending on where you're at and who you're focusing on. So we started a program. We did a 12-month program last end of April, and wherever 12 months went off, and that went well. Oh, 12 weeks.
12
Yeah.
weeks,
Why did
Karen.
I
That's not a big
say 12
commitment.
months? Oh my goodness, 12 weeks. And that went well. And last thing I want to say is Mike and Kevin came to our Boston event, and that was a ton of fun. People really loved what they had to say and so forth. So we're back again, just so you guys can learn more about functional testing and learn about metrics as well. So Kevin, are you kicking us off? And then I'm sure Mike will chime in as you guys go forward.
Yes, I know you guys were talking a little baseball earlier, so I told Mike I would take control and I would throw him some softballs that he could knock out of the park for us later on. So
Awesome. Thank you, Kevin.
we should all be good. So my name is Kevin Cairns. I am the founder of Metrics. I have trained thousands of people in functional capacity evaluations over the past 25 years. I am currently also teaching business at a couple of universities to healthcare professionals. And so I'm bringing that to the table, and maybe I'll let Mike give us a little introduction about his background.
Sure. So similar to Kevin, I've known Kevin for about 25 years. I've got about a 25-year history of being involved with functional capacity evaluations and functional testing. First as administrating the protocols myself as a clinician, then organizing and training people just like Kevin did. I haven't done thousands, but I used to train for a large corporate organization I work for. And the last 10, 15 years, I've been more on the business development side of functional testing. So that's sort of my background related to functional testing.
Okay, so we put a little slide deck together. We're just getting a little more organized now that we've gone through this program one time. So if you want to unlock revenue in your therapy practice without wasting months guessing on what works, then you should keep watching the rest of this webinar with us. So the agenda, so we're hoping we got a bunch of people here in the audience, and just want to make sure that we could talk to everybody. So Part one, where we have a little section here on people who are already doing functional testing, another section for people who are already treating people doing workers' compensation. We have another one for people who are treating patients who have jobs. And then a section on someone for patients that don't complete their treatment plans. And then, so hopefully that hits most of the people in our audience. You'll fit into one of those top four categories. And then a common question we always get asked is how do you market and sell functional services? And then we'll finish off with question and answers related to the the FCE Business Accelerator program to be more precise. So I looked at the the name of this. So 2 ways to unlock revenue, and I thought, okay, what does that actually mean? So number one, we could add top line revenue via new sales. Or number two, we could add to bottom line revenue via efficiency. So those would be 2 ways that we could add revenue to our businesses. So when I was looking at the 1, 2, 3, and 4, I'm going to try and use this chat again. So I think we've got that already, the answer to that question. So I wanted to know if you're already offering functional testing services, and it looks like we have Laura and maybe Teal already doing them. And so the next sort of slide will kind of appeal or be speaking to you, but it also should give you some more information. So if you're already providing the services, then we're really looking at adding revenue to your bottom line. And so the Metrics FCE software can make it more efficient. So we have an automated data collection, we have automated report generation, and really the coolest feature about what we're doing is that you can use your existing template. So we're able to take probably a template that you've already built, that you spent lots of time convincing your referral sources, or you worked with your referral sources to develop a really good report template. You don't want to go and have to use a stock template by some software developer. So our software will allow you to use your own template. So that's for all the people who are out there already doing that. Is one way to unlock some revenue is going to be in efficiencies. And so what we're seeing on this was Mike made me do this slide a little while ago. This was one of those business slides he really wanted to see on there. He said, Kevin, you really got to show what's going to be going on for the money part of it. So we're seeing like a 75% reduction in report writing time. If we look at that over a quarter, then you're saving like 80 hours. And so your bottom line, you're adding that 44K. So he wanted me to put some proof behind me just simply saying that we're adding some revenue to your bottom line. He wanted me to show you the math that we utilized for that particular purpose. So now in the chat, you can just tell us yes or no. Are you treating workers' compensation patients? So are you treating any workers' compensation patients right now? Kara is. Got some no's in there. All right. So if you are treating workers' compensation patients already and you answered no to the previous question, then what we're going to suggest that you would start offering FCE services inside of there. So the way that you would be adding revenue to your practice is with your current workers' compensation patients. We can now offer FCE services. And so maybe you're going to think to yourself, well, what is an FCE? So a functional capacity evaluation is a structured objective test, typically takes 2 to 4 hours, measuring the person's ability to perform work and daily activities safely and reliably. It bridges the gap between clinical recovery and real world function, guiding return to work, disability, and rehab decisions. So the price range we're seeing in the US is somewhere between $600 and $1,200. And so, Mike, I know you've been speaking to a lot of people who might send these referrals. What kind of groups have you been talking to recently, Mike, about where referrals might come for this kind of stuff?
I've been speaking to occupational health and safety companies, so providers of occupational health and safety companies. I've been talking to like a Concentra, for example, groups like that. I've been chatting with network providers like MedRisk and OneCall and people like that, and I've been talking directly with some large employers as well, that self-insured employers that are looking at finding providers to do various services for them, from workers' comp to pre-employment testing. Kevin, not to dive too far off, but a range of things where functional testing could be used to help their business operations.
And if we're thinking about the network people that you've been speaking to, what's the conversation been like that you've been having with those guys?
Um, they're very interested in having more people that can be added to their network. Like that's they're always looking for people to be added to their network.
So I think what you're what you're saying is that getting onto a roster would not necessarily be a difficult task.
It would not be a difficult task. I think one of the things, not to, I feel like I'm some author right now. It's in the book, read it in the book. When the accelerator course too, of looking at people's personalities, business personalities, and which groups you would enjoy working with. But certainly network providers are one of those groups that they take away all the marketing requirements. They just send you referrals to a referral source. Just keep doing what you're doing, or add in a new service as a service provider, not having to worry about marketing or any of those sorts of things new. So yeah, there's always a shortage of functional testing. They've got lots of people providing treatment services, not enough people doing functional testing services. Quite often
And
they
if
have
we're
to send people further for functional testing than they do for treatment services, and they'd like to minimize that as much as they can.
And when you and I were discussing this, would you agree that working with a network is the easiest way to get started if you're new to FCEs?
I think so, Kevin. Yeah, it's they lay out everything that they need done. So if you're looking at being creative, maybe not the place to start. But if you're looking at getting referrals and get started with it, they'll have a protocol for you to follow. They'll have requirements of access time, and they'll provide you with feedback on your reporting, so you get better at reporting pretty quickly as well too, with kind of like a teacher and a red pen.
Okay. All right. Well, that's really good. So if we're thinking about adding services, in a call I just had earlier this week, the further question comes up is like, what am I going to need to be able to do that? And I'm just going to quickly show you that we would need some sort of a hand in pinch grip testing. We want some sort of range of motion stuff. And these two items are often things that you're already going to have in your clinic, and so you don't need to buy new versions of those. You probably may also even have some way that you can do the lift testing. So you may have a shelving system that you have already. But the other things you would need for that would be some weights and a crate, but really a milk crate, and any weights are going to be able to meet the needs for that. What you're looking at here in this picture, and it was one of our more exciting things we were talking about in Boston a lot, was we've developed a little telescopic ladder with these portable shelves. It just makes setting up a lifting station, if you have a small clinic, or if it's a small facility, or if you're mobile and you're having to set up and tear down, that just makes doing that sort of process really sort of simple and easy. So we have that available. And then the one piece, which is actually a metrics piece, is the push-pull device. And so it's the sort of only non-common thing in terms of all of the things that we would see out there. This is a push-pull device that would measure the person's ability to push a cart, pull a cart. You could also use it for things like manual muscle testing, or testing individual strength along those lines. And then that really leads to the second question, which is like, how much space do I actually need to be able to perform a functional capacity evaluation? And I think there was a time that you required a lot of space, and you had like all kinds of big FCE equipment and a big tower and computers and all those kind of things. But you can see here in this really short 40-second video, this is all being done in a 10 by 10 room, with the only additional thing is that they have access to a hallway to be able to do the walking and the carrying test. And again, you can see the use of that portable ladder. And you can see here the use of the push-pull device to be able to perform all those things. So we can do a full functional capacity evaluation in a relatively small amount of space. So you're not having to if you're already a mobile practice, you can be looking at renting a room for a time. Like Mike, what, like in your experience when you were running with your corporation, did you always do testing in clinic, or can you maybe tell us a little bit about some of the other places that you might have done some of the testing?
I think I was everywhere, Kevin. So clinic for sure, but also right in the workplace, going to the workplace and doing functional testing right in the workplace. Um, Libraries, renting a room in a library, in a hotel, especially if I was going to a remote area. Sometimes I was driving for as long as it was I was driving as long as 2 to 4 hours to complete the functional testing. So that's what I like about something as simple as this, because they weren't nearly as mobile when I had a real job and was, working clinically. So
We have a question, Mike, from the chat. So if you rented space in a library, hotel, did you need liability insurance?
that's a good question. Maybe check your own liability insurance. I had liability insurance, and if I went somewhere, I was covered with regards to, somebody tripping and falling, getting into the facility, those sorts of things. That was part of my errors and omissions, my malpractice insurance. I had that for doing it, but
And then depending on, in my experience, depending on the facility rental agreement that you make with
yeah,
whoever
yeah.
you're renting from, that they'll often require, and they typically will include some sort of facility rental thing. Certainly at hotels and those kind of things, that's going to be built into those practices.
Usually built into your fee that you've paid for your rental fee to cover that. Yes.
Yeah, but
Good
excellent
question,
question.
Fran.
Oh, Oh, Elizabeth has a question. Since the course is 12 weeks, how much does it cost? Because Elizabeth just wants to jump right to the end. Also, if I wanted to train an employee in FCs but doesn't need business marketing tips, is this the same thing? Excellent. So, you know what, we can we can talk about these things out of order as well. We've been doing this for long enough that Mike and I are flexible. So we'll jump way ahead. We built an all-inclusive program for Kara's first group, which lasted for 12 weeks. The concept there was, in that 12 weeks, you were not only getting 12 weeks of our time, although I think we're going to move it down to 10 weeks this time, but you were also getting the FCE certification included with that. You were getting all of the equipment included in that, and then you were getting the software included. So it was sort of an all-in-one, I just don't need to do anything else kind of a package. And we can do everything a la carte. So the full course is a $5,000 course. Of course, there's discounts depending on your relationship with Kara and her group. So we've offered some special discounts with her people. But if you do it a la carte, we can look at the pricing stuff at the end. But you can, yes, you can just buy, for example, you could literally just buy the push-pull device from us and nothing else, or you could buy 2 FCE training programs from us. So we can sort of mix and match. Maybe that's a short answer, and as we go through the rest of the stuff, we can kind of
And we certainly had people in the first program that we did where there were 2 or 3 people, and it was set up. The first month was really the certification part of it, learning the skills, how to do the functional testing, and the people that weren't going to be responsible for business development or securing referrals just dropped off and continued on doing functional testing, and other people stayed. So as Kevin said, be a la carte.
So, that last group was if you were already doing workers' comp patients, because we know if you're already doing workers' comp patients, then it's not such a big leap to get into the FCEs. But if you're not treating workers' compensation patients, you're not already doing FCEs, but you're treating patients with jobs, and this is always my favorite question to Mike. It's like, Mike, how did you start building your business when you were a young man, and I'm assuming both of us had hair
A
at the
young,
time.
skinny guy with a full head of hair. It's a long time ago.
Like when how did you what was the sort of very first, like, or maybe we'll call it tactic or trick or them that you utilized to try and secure business for doing functional capacity
Yeah,
evaluations?
what I simply was, I've always been a curious individual, so I wanted to provide the best rehabilitation programs that I could. So it was really looking at therapeutic exercise and just ask people what they did in their job. And invariably they'd say, well, you don't understand what I do on my job, even if it wasn't a work-related injury. And then I would just ask to go and have a visit of the facility so I could better understand the job. My classic line, you've heard it over and over, Kevin, is, you don't understand what the big blue machine is. Well, I want to go see the big blue machine. And so people are usually very, very pleased to let you see what they're doing. And I was doing it to allow their workers to get back to work sooner. And I actually started not doing FCEs, but just using functional testing as part of the therapeutic treatment program.
Okay, and Elizabeth is already leaving, is already leaving us, but they're off to another appointment. But there we go with there we go with that point. Thank you, Mike, for jumping in. So yes, talk to your patients, find out where they work, and that's if we don't need to be scouring the internet. We probably have the information right in front of us already, assuming that your patient population is not a geriatric or a pediatric population. If they have jobs, then you're likely going to be able to ask your patients, and that's going to be a good place to sort of start that referral process. So Mike, here's some of the softballs for you again. I know this is where your expertise lies. So I know you said, I want to see the big blue machine. I wanted to give some value to these folks out there. So if they're going to talk to the employer, who are the types of people that they would talk to, and what are the sort of different problems and solutions those guys face? And feel free to read this
Yeah,
off the screen, but I know you can talk off the top of your head too.
yeah. Well, if you're going to be going and speaking with an employer, there's going to be different individuals that you end up chatting with, and they're going to have different needs and different requirements. So one group you don't have up there, Kevin, is the union, if it's a unionized environment, because that can create some potential conflict for you. But if you're speaking with the owner, they're going to want to understand something about getting back to productivity as quickly as possible. If people are injured and not at work, then that may mean that they're not making enough widgets. People are on modified duties for long periods of time. As clinicians, we tend to recommend modified or graduated return to work. And that is something that drives employers nuts, like how long that lasts, because that has a burden that goes along with it as well. If they're in finance, there could be other things that are happening with accidents, such as increasing insurance premiums, increasing workers' compensation premiums. HR managers, their jobs to fill those positions. So anything can be done to make recruiting easier or less people getting injured so they don't have to recruit. Those are the types of things. What we do in the course and in the program is we create avatars so that you can speak their language. I guess that's probably the biggest thing, is not speak the language of being a clinician. Remember, people don't buy what we do, they buy the outcome of what we do, which typically is having less injuries, shorter durations of modified work, and getting back to full productivity. Those are the things that are going to drive all those different folks, from the line supervisor to the HR manager to the CEO. Union leaders, they're going to be, everybody will be, but the union leaders will probably be most concerned about safety. So if we're going to be sending people back to work, are they safe and ready to do so?
Okay, excellent. Thank you. So, we've looked at a couple of different things. And Mike actually already touched on this a little bit, but so in the chat, do you have patients who aren't completing their full treatment program? And so again, our outline here today was to look at ways for you to unlock revenue, which would suggest that the revenue is already in your practice, and it's just a matter of you figuring out how to get that revenue. And so if you have patients that are not completing their treatment programs, there was some research that was done recently that suggested that only 30% of patients who receive outpatient physical therapy services attend all their visits that the insurance company authorizes. So this is not them running out of money from their insurance or anything like that. They just simply do not attend all of their sessions. And of course, well, when we're talking to clinicians, they'll say, "Oh, I'm just really great at treating patients. That's why they got done so quickly." But we think that it's highly unlikely that there's going to be a full functional recovery within the first 6 visits. And so this again, the top 3 things here are coming directly from that research. But one of the things that Mike and I have been speaking with a number of different groups about is this idea, the cost of acquisition of a client is going to be the same whether they stay for 6 visits or 12 visits, but your revenue can double by having the patient stay for 12 visits versus 6 visits. So one of the ways that we can look at this problem is that patients are stopping when they feel better. And what our solution to that is we'd like to use functional progress testing to reframe their ideas, which would be, relative to the 2 points that were in this research here, that patients are not engaging in their care, or that PTs, in this particular research piece, are not effectively demonstrating the value of completing the course of care. And so we want to reframe this, that treatment is a success when you are functionally durable. So I'll give it to Mike. I think Mike came up with this durability term, which I really like, is that we want our people to be durable. We don't want to get them just to the point where they feel better, because that's really just the point that they were the day before they got hurt. And so if they go back to work, they're likely going to get hurt again. We want this person to be durable. So, like, Mike, can you give us kind of like a little real world talk about the way that I've laid out this piece of research?
I think, well, I guess a couple things before I hit that, Kevin, as well, is, yeah, we've been working with groups where they were averaging 4 visits and they've gone up to 8. So that's the whole clinic, 5 or 6 clinicians they've been able to increase. But also think of the outcomes, because we're all in the business of helping people and making them allowing them to get better. And what we find with functional testing is their compliance to any exercise that you give them significantly improves, because now they have a target to work towards. So if you're doing, even if it's somebody who hasn't got a work-related injury, they've got knee pain or they've had knee surgery, is even doing a bilateral comparison of their knee extension and comparing the good leg and the bad leg and seeing what that difference is, and then giving them exercise to do, and then setting a goal and having them move to the point where they get to or close to bilateral comparison. And so we end up with better outcomes. If people have been injured for a while and the pain goes away, great. But if their function isn't at the level it was beforehand, they're probably going to have a re-injury. They're not going to be durable. And then who do they blame? They usually blame their physical therapists or occupational therapists or exercise physiologists that they're working with. So this is another great way to improve outcomes, but also the best form of advertising is by, word of mouth is the best form of advertising, because you got them better. You go back to all the functional things that they weren't able to do for the last several weeks or months, depending on the nature of the injury.
Right. And when we were in Boston, they were talking about the KPIs, the key performance indicators, and the critical use of those. Do you have any comments related to KPIs?
I'm not sure where you're going with the KPIs, Kevin.
Oh, sorry. When we were in Boston, when they were doing the speaking, they were talking about this idea of KPIs and you just utilizing something that was less subjective and more objective in terms of it. You've been speaking to the point, and I was just trying to reframe
Yeah.
it around the terminology we heard together in Boston, which was KPI, and the use of objective information like we would get, say, from this force gauge, where we can be quite precise in terms of the improvements that we're showing. So if we're doing a particular therapeutic exercise and we want to show that it's actually working, we can have quite granular changes in strength that are demonstrated through the, say, use of this digital force gauge versus a manual muscle scale of, say, 1 to 5, where it's very
Okay, I
hard
got you.
on a
Yeah,
granular
yeah.
scale. It's very hard to show that you've actually seen improvement in those in that patient population.
And also with a payer, it's helpful using functional testing to get approval of your treatment plan, because now they can see an objective number that this is what you're going to do, and this is the reason that you need 2 more weeks, 4 more weeks, X number of treatments extra, because you've got a goal that you're working towards that has a functional KPI with it.
All right. So, you know, again, I've been using the chat out. I think based on the number of responses, I can kind of see the number of people that we have here. So feel free to chime in or not. But we just wanted to kind of keep the interaction going with the yeses and nos. If you're interested in doing the sales and marketing, so this was a big part of what we did in our not the 12-month program, but the 12-week program that we were that we just completed. Was that more than half of the program really related to these ideas around how to market and sell functional services. Um, and so yeah, Kara's had a long day already today. And so when we're looking at marketing and selling, so Mike, would you agree that when you speak to clinicians, most of them will say that I've never been trained on how to do sales and marketing?
Yeah, most of them feel like used car salespeople. How can I get you into this, FCE today sort of thing? Which,
So
go ahead,
it's
Kevin,
not
sorry.
the approach that we should take, right, Mike?
Not the approach that we should take. So yeah, no, it's just, and I think one of the biggest challenges we have is as clinicians is often if we're going to solve problems for somebody, whether that be an employer, a lawyer, an insurance company, to find out what their needs are, we need to ask open-ended questions. And as clinicians, we're often asked to, we're all trained to ask closed-ended questions. Is it better? Is it worse? Yes, no. Give me a number from 1 to 10. And I'll ask between a 6 and an 8. I need a number between 6 and 8. So that part of it, just being trained and understanding that, closed questions usually don't help you build a rapport and a relationship with a referral source. So there's that aspect of it, of asking open-ended questions, and then using, I think I've mentioned this a couple times, but we need to speak the language of whoever we're trying to solve problems for, not our clinical language, because they won't understand our clinical language. Again, they don't buy what we do, they buy the outcome of what we do.
Can I just
So
stop you there just really quickly? So I'll just answer this question in the chat. So this is being recorded, and Kara will have more information about the availability of the full recording. We just have another person who's got to jump out, Mike. So I apologize for jumping in. Hopefully, I haven't knocked you off your knocked you off your speech there. When we're thinking about doing sales and marketing, and we're thinking about leads, what are the different what are the different parts that we've used together, or you've used to generate leads in the functional capacity or functional testing world? Oh, you're on mute, Mike, somehow.
it's because I was done talking. Um, One of the things I think we've talked a lot about, Kevin, are lead magnets, and we talk about lead magnets in the course. Is what can you do to as a lead magnet to get somebody to try what you do? So you can do things like a free trial to get people interested in what you're doing. You can reveal a problem they didn't even know they had, or you can provide a limited to solution to a much larger or complex solution. Is that the sort of things you were asking about, Kevin? Was
Yeah,
that?
absolutely. That was a better answer than that was excellent. So maybe do you want to like just so we provide some actual value? Do you want to do you have I have one if you don't, but do you have an example of a lead magnet?
You go with one lead magnet, and I'll come right after you with another one. Okay.
Oh, okay. Well, I'm just gonna jump to the next slide here.
Okay.
Um, and so I just think I figured as long as we're talking about sales and marketing, we may as well promote the sales and marketing that was actually produced in our last. So these are all student developed pieces. And so when Mike and I were doing this section, I was actually teaching a university course on the same night, so Mike and I were swapping a lot between things, and so I unfortunately missed the lead magnet night. So Mike was taking care of that one. I was quite disappointed because the quality of work that was done by the students from Kara's group was amazing. And so a lead magnet, as Mike had mentioned, is some way to attract people to you. So effectively, you're trying to give something away for free to attract them to provide you with their contact information. And generally, in the concept of a lead magnet, we're also trying to weed out people. So we're trying to get rid of, I will use Mike's car salesman. We don't really want people who are kicking tires. So we also want to create a lead magnet that weeds out the types of people that we don't want. And so, one of the reasons that we, well, Laura knows we pulled up one of hers. One of the reasons that we started working with Kara's group is we know that the people in her group are the kinds of people that we want to work with. They are entrepreneurs, they are people who are excited to develop their business, so they are a perfect fit for the kind of things that we do. So, somebody built a calculator, a light duty cost calculator, and a readiness audit that could be used. And it was a very complex and a program and a series of questions that they had put together that they were going to give to free to employers so that the employer could calculate the costs of how much it costs them to have a person out on light duties. And Mike had already mentioned is that the point of the lead magnet would then it would shine a light on a problem that they have, and that then they would be able to come in and solve that particular problem. So I have that lead magnet. Did that give you enough time, Mike, to come up with your own memory of a
Well,
lead
I
magnet?
think the other thing that I like is lead magnets quite often too are various checklists. Like, the 7 things you should be doing to enhance return to work or to prevent injury or those types of things. So it has value to them. And typically you're asking people for some contact information, phone number, email, in return for something like the cost calculator or a checklist of some sort. So checklists are it's always interesting after you do all these and teach courses, then you see people sending you lead magnets all the time as well. So
Yes, you can you can start to identify those different things. So um,
I think
another
the one thing I would caution with lead magnets though is there's a tendency to give away our services and our billable time and giving away too much of that. So just be careful of being too generous sometimes, I would say, with lead magnets. Here's a free functional capacity evaluation. Well, that's you know four
yeah,
or five hours of your time, of your valuable professional time.
that is a very good point. So the purpose of the lead magnet should be to shine a light on on a problem so that you can come in and solve that particular problem for them. One of the things we do like to do is grow organically, and when we say growing organically, that means we're not using paid advertising. And one of the ways that we can grow organically is we can post content. And again, when we're looking at posting content, we're posting information that's hopefully going to be helpful. And I'm guessing with these webinars, Laura can't speak. Is that true? Is that the way that it works? It's only us, the panelists,
Oh,
that can.
I can give her the permission to speak, so.
Oh my goodness. Okay. Yeah,
Yeah.
if you could do that, then that would I would love to hear because Laura's approach is outside of the scope of what we've been talking about so far. So while you give her that permission, and once she's got that permission, if you want to just put a note in the chat, and I'll give her the contact. But
Yep,
um
she should be good to go, Laura, yeah.
I think I'm here. Can you hear me?
Okay, yep, we can hear you.
Perfect. Do you want to tell the group, because what you're doing, we haven't spoken about directly, and I was kind of hoping you'd be here because I thought, well, it would be much better for you to tell the group what kind of how you're using functional testing in your practice.
So obviously I'm the kind of the one that started working with the attorneys, and I started doing that. But what I'm starting to do now is really use it with my seniors a lot. So especially those seniors that we're trying to work with for aging in place, it's giving me an opportunity to give the families and the clients really hard data about what they can do to make sure that they are safe to stay in their homes. So it's really nice. I'm getting really good feedback from some of the physicians here where I'm at, that I can actually say, oh, she really can't stay at home because she really can't take care of herself. She can't lift, she can't do a lot of these things. She can't stand in her kitchen for any length of time, all of those things. So it's been a really great opportunity to use this testing to really give us standardized numbers instead of just min, mod, max, and the normal things that we usually use in our OT belt for working with seniors. It's been a really great thing for me so far.
Amazing. I mean, I know you and I are diving deep into that topic.
Yeah.
The what what about do you want to just so everyone knows this is Laura's company here. And do you want to tell us a little bit more about the legal side of things?
Sure. So I kind of fell into the FCEs. I found I was friends with an attorney that asked if I did them, and so that's how I kind of found my way to this. It was something that was needed here where I'm at, and it's kind of morphed into just doing more than FCEs. I do a whole support, legal support services. So I do home modifications for a lot of the attorneys, and I do a needs assessment that I kind of created with some of the attorneys to find out things. And then the FCE piece of it, which is great because now they have this hard data. And I kind of sat through and audited this program again when we did it with TBB, and part of one of our homeworks was kind of figuring out ways to take things and market better. And so I came up with something called a 15-minute need snapshot that I came up with one night and randomly sent it out, and it actually worked. And now I've done a few of them where I've offered to talk to one of the attorneys can send me somebody, and I will get on a phone call or a Zoom with one of their clients for 15 minutes and kind of talk to them and figure out where maybe there's a gap in their care or where there's some needs issues. And then within 48 hours, I send a little PDF back to the attorney and say, you know what? I think that they are having more issues at home than you think they do since the last doctor's note. I think they would benefit from a full FCE or a full home eval. So I may have this lost time of 15 minutes, but then I can kind of sell the other things that I think they need in the end. So it's led to a couple other opportunities with home assessments or needs assessments and even an FCE based on that little 15-minute phone call. And so now I'm getting ready actually to start doing some major marketing. I'm shooting some little mini commercials for some of the attorneys and kind of pushing this 15-minute needs assessment. So it's great. And it all came out of that program and this conversation with Mike one night. So
Amazing, amazing. And then the last sort of marketing thing that we wanted to mention, which is also something that we did in the program, is something called a video sales letter. So video sales letter acts really for cold outreach. So really talking to people that you don't know. It allows you to create a video, and based on that video, you can then speak about your FCE services. And I don't think
Can you play it, Kevin? Is that what you're trying to do?
I was trying to click on it. I have it over here. I just wanted to show you that. So the person who one of the students, this was their video that they did as part of the as part of the as part of the program, and they sent us a big thank you about the about how the course deepened their understanding. And so this was her video sales of it, which was really amazing about how people in the clinic weren't getting better and how they were using the functional testing to go back. But these video sales letters can sit in your website and then speak to potential clients about what's going on. The really funny thing that happened to me today was as I was putting together this slide, I literally got a message from Lexi, and she was, I'll pull it up there. And so this is the message. So the marketing skills that she's learned have been invaluable, and she was so grateful that she got to learn more about the FCEs from us. So she had made the original video, and she said she really wasn't satisfied. So she literally sent it to me today. I don't know what we are now, a few months after the course has been done. She really wanted me to see the updated video that she's been using, and they've had great success at the clinic with their marketing that they've been doing in terms of FCEs. And so she just wanted to share that with me, and I thought I would pull that. Thought I'd pull that up, and I thought it'd be like a good segue for us anyway, as we kind of approach into the last few minutes to see if there were any other questions. So the company, I'm going to read this question, Mike, if that's okay, and maybe you can help me answer. The company I just agreed to do some FTEs told me that in my area near San Francisco, the medical risk only pays about $350. Does this sound reasonable? Also, they mentioned it sometimes comes direct from attorneys and they pay much more. Can you give me some ideas of what they might pay? Sure.
Maybe have
You know,
Laura go and talk about the attorney stuff first, so we don't lose her if she's still there, Kevin.
Still here.
Oh, yeah. Do you want to talk about how much attorneys are paying? I mean, it's not going to be the same, but I know you were
Yeah.
California.
So, you kind of have to kind of figure out what's the going rate in your area. And there's two other people in my town that do them. And I kind of figured out what they did and set mine a little different from them. But, they're charging anywhere between $800 and $1,200 for an FCE. So in kind of the Omaha area. So there's a lot of opportunity there, and it's kind of how you market yourself. So I really lean into the fact that I'm very neutral, that I don't see the meta, like the work comp people for their actual rehab, that I'm super neutral, that I have my own special office where I don't see things. So it's very neutral, and I can charge a little bit more for that. So it kind of depends on how you market, but I have another friend in another state that's charging $1,500 for her attorneys. So the money is definitely there with the attorneys because they've got their slush fund, and you have to be careful with that too, because sometimes they'll pay you ahead of time. Sometimes I get paid before I even see them, and then sometimes they're waiting for the next retainer to get in before they pay you. So but for the most part, my attorneys are great because I usually get paid before I even see the client.
And then to answer the
Kara.
350 part of it, I'll go first, Mike, and then I'll pass it over to you. But that's going to be with the networks, they may negotiate a flat fee with you, and maybe that's what you're seeing for the 350. That's definitely at the low end. We know that the averages run between 6 and 12, but that you will see for certain things lower fees for them, and 350 is not outside of the realm of possibility. Mike, did you have a comment on that?
Yeah, I'll let Kara. Kara said that she could chime in as well. I'll let Kara go, and then I'll jump back.
So what we're finding is, some of the different organizations we work with have their own completely different way to submit billing. So with a workforce safety contract that we have, they actually, and I have multiple things pulled up so I don't miss anything, they actually do not assign a fixed dollar amount for the FCEs. instead they will pay the provider whatever amount the provider bills. Of course, assuming it's reasonable and requested and approved by WSI and meets their documentation requirement. So, you know, how we do that is we have a set amount for kind of the initial hour, and then we bill per 15 minutes after that. And then it includes the time we're spent with the client and the documentation following. But it's also interesting, see if I can pull up this resource, that they have different codes where like they'll even reimburse if you have a FCE scheduled and the client cancels, they'll have a fee that you can charge and get reimbursed for that as well. So, you know, things can really can be different. So other things like a WSI medical case manager visit, you know, that's around 180. But when we get down here, they have a code that we use that's specifically for a functional capacity evaluation. And it just says 100% of billed what we bill. They have another different code for that FCE no-show. And then they have another code for more of a specific job site analysis, and that's also 100% of what we bill. So you never know. It can be based on the different organization and, you know, what the provider that you're working with has with that. And this is different than initially when we started to work with this workforce safety. Someone had told us to bill differently, and then that got denied, and then we're like, well, you told us to bill this, and now then they send us out this whole new form that explains you actually have to use this different code, and you charge one lump sum, and then they pay 100% of what you bill. Of course, it has to be reasonable and appropriate with that.
Yeah, I don't think I have
For
a
anyone
ton
who's
to
in the
add.
audience. Oh, let me go one more time, Mike, and then I'll let you all
Yeah.
pass it off. Sorry. For anyone in the audience, I do also have another person who's working with me now who is an expert on FCE and reimbursement in the US. He didn't join us tonight, but he will be working with us. So he worked for a big organization in the US that provided services in all of the states and is familiar with how to bill in each one of those states. And so he'll be able to help any of us with the process there. I mean, his short answer was, Kevin, it's complicated. But having said that, there are billing codes very specific to that, to it, and typically we can bill 16 units for that. But he said it does get complicated in the sense that there are a number of people who do have flat fee services, and even with the flat fee service, you're still billing your 16 units. And anyway, I'll pass it on to Mike now.
Kevin, you exactly mentioned what I was going to mention, so that's great. We're on the same wavelength that way. I think the one thing with functional testing, there's lots of different. It's not a niche service. There's a lot of different groups that you can work with. So quite often, you need to find your business personality. Who do you enjoy working with more? And so think of things like, how do you handle uncertainty? If you're going to work with employers, for example, they love to negotiate. They negotiate with everybody. If negotiating is something that you enjoy, you may not want to work with employers. How much do you enjoy marketing and relationship building? That'll determine kind of the groups that you work with. And do you prefer complex and precise type of work, or higher volume routine cases? Laura's obviously picked kind of the complex precision cases with lawyers. That's not everybody's cup of tea. So that's the nice thing about functional testing. There's a lot of different referral sources out there that all have different needs that can fit with how you want to do it.
Excellent.
Somebody was asking what people are charging. Yeah, I think Laura mentioned Googling. You can always do a deal of industrial espionage and call, but they're not usually posted.
And so this is 1 hour, right? So are there any, that's what we schedule this for, right, Kara? I just want to double check. Okay, perfect. So are there any, because we have just like 4 minutes left, are there any last questions from our group here? Kara, do you have any last thoughts that you wanted to pass on to the group related to this topic?
I'd say just out of curiosity after what we talked about tonight, who is interested in adding this on to your service? And, getting into doing more FCEs and or functional scenarios, if you just want to give us kind of a yes, no, maybe, just so we can kind of gauge where you guys are at. And then if you have any additional questions, we'll answer those as well. In fact, Kevin, we have
Yeah.
can you talk more to FCEs for general medical issues versus workers, similar to the seniors?
Sure. Yeah, I mean the traditional home or the home of the FCE is typically related to the workers' comp, but it certainly doesn't live there entirely. And so that's where the full functional capacity evaluation is probably going to exist in that in the space where you have a worker kind of piece, but where you're looking at the utilization of functional testing, which is kind of something Mike and I are really sort of trying to push towards the use of the functional testing term as opposed to the FCE term. And so you would be using functional testing as part of your treatment programs. And that was really where I was going with that idea about the KPIs, about the treatment outcome measurement piece, where it's the introduction of small amounts of functional testing to measure progress in a different way than just measuring or monitoring their pain levels throughout throughout the therapeutic intervention. So that would be where you would find a home for that as well. Nikki says, I'd like more about how the program runs over the 10 weeks. Okay, so as a general thing, Nikki, we spend the first few weeks getting you through the FCE certification. So the question we have from the audience is, what does the 10-week program look like? So we're going to spend the first number of weeks getting you through the FCE certification. So you'll be working with me during those weeks. I'll take you through the process of making sure that you fully understand. We have an online program, but I'll make sure that you fully understand how to do non-material handling, how to do material handling, how to write the reports, and kind of getting us through to that part. Then we switch over and Mike and I work together on the sales and marketing aspect. And so we go through the process of what type of marketing that we would do, how to set up an offer, how to build out all of the things that you saw inside of here. So lots of exercises for you to do, things that you're actually building that are going to be then useful. And you can see that from the message that I'm getting here, that even from what Laura's comment is, the things that we're building in the course are then things that you would then be able to use directly into your practice. And then if we want to look at like three sort of chunks, then the final kind of part of it was going back to the FCE a little bit and just looking at how to fully write out the reports, and also how to write out the smaller reports like the functional programming. And then Mike would finish off with some of the things we've been touching on here tonight, but sort of exploring other areas that we could utilize the functional testing in. So it's kind of in a third and a third. So 1/3 just purely FCE, 1/3 in business development, and 1/3 is kind of a combination of the two at the very end. And there are live classes once a week, and there will also be recordings, and Kara made me promise that there would be only 1 hour of homework a week. That was the that was the promise, that we wouldn't overrun you with things that way. But all of the material would be available for you online. So in addition to the work we do together, you would be able to review it in real time.
There
as
was,
well.
I think, tremendous value with the people participating in the class sharing during those live sessions. I think that was really powerful and helpful. Because
I
we
would
had
agree.
somebody working with workers' comp, somebody doing insurance, somebody doing, working with lawyers, and they could, it was really a nice environment where people could provide really, really constructive feedback. It was a great group.
And it was exciting to see that people were actually getting work during the
Yeah,
during the
yeah.
course of the piece, and then being able to bring that back to the group. So that was and just their experiencing just because there's so many. FCE is not just a single entity, which you've already mentioned, Mike, and it's can be used in so many different. Just seeing how people are utilizing it in different ways and their experience with it, and yeah, absolutely. I think there's absolutely true value in working with a cohort, and being able to share your experience together.
And I
So
just
much of what
wanna-
we do is, go ahead, Kara, sorry.
Oh, I was just gonna say, I just wanted to also kind of give a shout out. The first group we did this with was really a beta test. And we limited to so many people, and then they also provided us with valuable feedback so that we can make some changes for the next time around. So, thank you to Laura and then the rest of the crew that participated in that program, because that was really helpful. And then we are also limiting it to where we stand like around 10 people. So we kept that small group size. So when we start this up, are we starting? I can't remember. The first Wednesday of October, is that when we're starting?
I think that's what we're looking at right now. Yeah.
Yeah. So we do have some therapists that couldn't do it in the spring that already want to do it. So if you are interested, let us know so we can reserve your spot, especially for you guys that were joining us live. So. Mike, I cut you off. Did you forget what you were
Oh,
going
no,
to
I
say?
just, we should take this show on the road. Thanks, Laura, for your comment. I always say objective testing allows us to make more timely decisions. And so right on with what Laura said, hard data. People improve so much when they're given confidence too by doing site-specific functional testing.
Awesome. So if people are interested in doing the program, what do they need to do, Kevin?
We have the link that we can send out to sign up for the waiting list at this point, just to make sure that we get the right number of people, and where they can contact us via email, and we can answer any of their questions about further questions about the how the program is actually going to work.
Perfect. Sounds good. Do you have a link that we could send out, or do you want me just to email that out afterwards?
I do have a link.
And then there's info kind of on the details of the first.
Do you want me to put it in the chat here?
Yeah, I'd say if you want to put it in the chat, that way the people that stayed on can kind of get first dibs, and then I'll email the rest out when I email out the recording.
Yeah, there you go. So I put the link in the chat, and then
Perfect. Okay, awesome. Laura said anyone can call or can email me as well if they want to talk about what it looks like in practice. Yeah, feel free to reach out. We, in our practice, what I ended up doing is having one specific therapist for now to get trained, and she does the FCEs for us. So reach out as well if you have any questions, but, yeah. That's it for me. Mike, Kevin, anything else?
I wanted to say thank you again. It's been another fun evening, and yeah, I agree with Mike. We're getting better and better every time.
Perfect. You guys are awesome. Okay, so thank you everyone for attending. Those that are watching the replay, we will be sending a link out so that even people that watching the replay, if you didn't get a link, just reach out to Kara at nextlevelot.com and we'll get you the info as well. So thank you everyone, and you guys have a great night.
Good night, everyone.
Good night.